Hello, this is Robert D. McMullen, MD. I'm a psychiatrist. I went to Georgetown University Medical School and to Columbia Presbyterian for psychiatry. Both of them were really wonderful institutions, a good place to learn, and a nice place to be. I want to talk about BDD, body dysmorphic disorder, and then after I finish talking about that, I'll talk about OCD, obsessive compulsive disorder, and some related disorders. BDD and TMS, and I'm going to talk about the treatment of these things. And one of the major treatments that is emerging is using TMS, transcranial magnetic stimulation. Many people consider BDD a type of OCD, but in any case, they are related. Now, body dysmorphic disorder is when someone has a preoccupation with one or more defects they think they have in their body, and it's an excessive preoccupation, and they often perform repetitive behaviors regarding this, like looking in the mirror a lot and spending a lot of time looking at it. And they may do avoidant behaviors too, that they can't stand to look in the mirror. Or if they turn the corner and they happen to see their reflection in a window, they're appalled because they're so disgusting looking. Whereas other people don't see this. There may be an element of truth that one side of the cheek is a little higher than the other, but that's true in all of us. There's a difference from one side to the other. To give you some examples, I had a fellow a long time ago who was a big, muscular guy who was a bit overweight, and he was in the trucking business, which is usually mob connected here, but I don't think he was. But his family came to me and brought him to me. And when he would go into a deli, he would feel humiliated because he thought that people could recognize or see his love handles, the extra fat he had on the sides, and he was humiliated about this all the time, but he kind of knew that people didn't really look at this, but he still thought about it a lot. And interestingly, when he was with his fiancée and they took off their clothes, it didn't bother him as long as he was with her. It was with other people. And when you treat people like this with serotonin medicine, like Prozac, Zoloft, Lexapro, Celexa, so on, it helps, although you have to use usually higher doses than with depression. And also cognitive behavioral therapy works, and also there's a new treatment called, acceptance and commitment therapy, ACT, which is similar to CBT. These work, and TMS works, and it works particularly well. Now, another case I had was this fellow who had the most intense depression. He must have been in his late 20s or 30. And it had just gone on for years. It was so painful. He had this depression. And I treated him, and he really got normal. You know, I felt like a genius, but all I did was give him 20 milligrams of Prozac or something. And then when he'd come in to see me, he always wore a baseball cap. And finally I said, "Why do you wear that baseball cap?" And it turned out it's because he felt very ugly. He just believed he was extremely ugly, and so this would at least cover him up a little bit. And he looked fine, just like anybody else. At school, because now he was going back and taking some more college courses in addition to his job, he went to sit down in a seat, and then a woman nearby got up and moved somewhere else. And this is just utter humiliation to him. It was so painful because he was really certain she was moving away from him because he was so ugly. And then with that type of disorder, if you just raise the dose, and I think that's what we did, is we just raised the dose higher, and then that diminishes. Interestingly, he met a nice woman, from India, on the internet. This was 30 years ago. And they got married and he had no problems. As long as he's with her, he became very happily married, did well. Another example is an early...
Maybe marriage is a solution.
Pardon?
Maybe some marriages.
Well, marriage is sometimes a solution, but sometimes you're bitterly disappointed, you know. And I forget who those people were that found all the ancient bones in Africa, the Leakeys, yeah. The son of the major Leakeys, he said, you know, all my life I thought when I got married, finally I'd get enough sex. And he said, then after I got married, I found out that's not true. And so sometimes you think things are going to be better, but they're not. Another example was a lady I had very early on who believed she had very bumpy knees, that her knees were too knobby. Now, she was very depressed and chronically depressed and had a bad early life, but this just obsessed her all the time, and it was torture to her. Although, you know, all she had to do was wear slacks or, you know, just cover it up, but still she'd think about this all the time. And I'm going to mention a couple of other examples later when I discuss the TMS, but I want to mention some statistics. 2% of the population has this BDD. And it's quite high, and often we miss it. And when I was early in practice, I found out that people come in with severe depression. Then I'd find out later that they also had panic attacks, or they had attention deficit disorder, or they were a little bipolar. And as long as I didn't ask, I wouldn't find out that they had these disorders, or I wouldn't happen to think of it till a few years later and would find that this is why this woman wasn't getting promoted at work, is because she really had attention deficit disorder. And when we treated her appropriately, she started getting promoted. Now, 80% of them report being abused as children or emotionally neglected, physically or sexually abused. It does seem that there's a higher rate of that having happened, including being bullied in school. If someone has BDD, 8% of their family has it, and someone with BDD has 7% of their family suffering with OCD, about the same percentage. So OCD and BDD are very related because they're both spending a lot of time being preoccupied with details and ruminating about things. One of the biggest problems with them is high suicide rates, because they feel so hopeless and helpless that they can't get whatever it is treated, and they feel like their life is over, and then if they happen to be in a depression too, they can make a suicide attempt. Another big problem is cosmetic surgery. Many of them will get multiple cosmetic surgeries, and a huge proportion of them want cosmetic surgery, and they just demand it, and they're almost always disappointed. The most known example of BDD is Michael Jackson. If you look at a picture of when he was 10 years old and when he was an adult, it doesn't look like the same person. He had 20 or more plastic surgeries. And then it went a little too far, where his nose became too pointed. And I'm sure that if you talked with him, he would tell you about all of his obsessions about how he looks and everything else. And he was severely ill with that, or at least it caused severe problems. In the people with body dysmorphic disorder, they've found physical differences. There's definite physical differences between people that don't have it. And they found this on a functional MRI. So that's an MRI, but it can be used to detect what's actually functioning in the brain at that time, and that you will have it, well anyway, but it's a little bit more complicated, and it's harder to obtain these fMRIs because they're mainly used in research. And these people have a hyperactive temporal parietal lobe. And when images come in, they have a special way of testing people's attention, and they have something called low spatial frequency images. And these are images that are just, holistic, big images that there's no really detail involved in looking at them. But when people with BDD look at them, they activate the area in the left temporal parietal lobe that's used for detailed observation. So they immediately activate the area that's hyper-focused on details in images that don't require that at all. And they also found very poor connections between the primary and the secondary occipital regions, and they had excessive attribution of importance. Well, it looks like processed information is aberrant, it's wrong, and it comes in, and then they attribute much greater importance to what they've distorted in the first place. And this is somewhat complicated. I don't understand all the research, but it certainly came out very different with the BDD people versus the people that did not have body dysmorphic disorder. By the way, dysmorphic just means abnormal shape. So body dysmorphic disorder is somebody who's obsessed with feeling that their body is abnormal. And I might mention that when women and men go for a nose job or something, they can sound as if they have body dysmorphic disorder because they'll describe every bump and everything on their nose in that area to the plastic surgeon. They just have it down to a detailed science. But the fact is, they don't go around all day thinking about it. And when they walk in to a deli to pick up a sandwich, they don't think, people are looking at me because I have an unattractive nose. It's just that when they want to improve the appearance, then they think about it and spend some detail thinking about it. But it's not interfering with their life otherwise. Now, the TMS works really well for OCD, and 50% of our first 20 OCD patients, they had an over 50% drop in their YBOX score, the Yale-Brown Obsessive Compulsive score, which is really a pretty dramatic response. And having just a 25% decrease is called a response in research because OCD doesn't respond well to any treatment, and there's very little placebo response. So if somebody responds over 25%, you'll look at the placebo group and practically nobody responded that much. There's now 4 or 5 different ways of treating OCD. There's the BrainsWay Deep TMS, where they have a specially designed helmet that goes deep into the brain and in the middle of the brain, and it hits this cingulate cortex. This is the regular cortex is on the surface, but there's a second layer, and this second layer is always dysfunctional in every psychiatric disorder, and particularly in OCD. And there's another area called the insula, which is under here. Now, you can't see it, but it's another layer under here. And these two nodes of a network called the salience network are dysfunctional in most disorders, and the BrainsWay H7 coil reaches down to that area and stimulates it. Now, it also stimulates the dorsal medial prefrontal cortex along here, which helps depression. So it's hard to tell how much the benefit is from reaching deeply and how much from reaching superficially. But in any case, it has a dramatic benefit for body dysmorphic disorder, as well as OCD. And Aaron Tendler reported a case of somebody who had failed with all sorts of TMS and ECT, who really went into remission with BDD with this helmet. Now, with the regular figure 8 helmets, there's now 4 or 5 different places you can treat the pre-SMA, pre-supplementary motor area, the supplementary motor area, inhibitory there, or you can do inhibitory in the right OFC or the left OFC. It doesn't matter, but there's quite a few different ways you can do it, and I think sometimes doing 2 or 3 at once is a better way of going at it. I had 2 interesting people that went into complete remission with their body dysmorphic disorder. And also they had something very unusual, that they had 4 or 5 disorders or more that all went into complete remission. I think these are the only 2 that have done that with me, and there's another one that almost. But Jonathan Downer in Toronto mentioned that every once in a while you'll see somebody who has so many problems that if you treat them with medicine and several medicines, you take the edge off and they improve, but you expect them to be chronically mentally ill. And then when you do TMS, you expect them maybe to get rid of their depression, but you don't expect everything to get better. And every once in a while that happens. And that happened with these 2 people. And he thinks, and I think, that it's because since this area is dysfunctional in all psychiatric disorders, maybe interrupting this loop allows the brain to refix the loop, but then it ends up refixing it so all the disorders go away. One lady was 29, and she had chronic cycling depression, cycling between agitation, painful depression, and then more moderate depression without so much anxiety. But she'd cycle in hours and in days. She had severe OCD with ruminating. At first I thought it was just part of her anxious worrying with the depression, but it turned out to be really OCD. She had panic attacks. She had massive generalized anxiety, so she worried all day long, and she was exquisitely sensitive to anything that would make her feel guilty. She had a big problem with pelvic pain, and I forget what else, but she had another thing or 2. And and then the body dysmorphic disorder, she felt she was very unattractive. She really felt she was ugly. And she was really a very cute girl, or a young lady, and really a charming, nice person as well. But she was convinced of this, and you could say, well, yeah, but you've had a couple of young men that you were interested in. Nobody's ever said it. Everybody thinks she's, quite attractive. No insight into it at all. She was convinced. Now, every one of her disorders went away. Gradually, things went away. She had like 75 treatments, but I treated her 4 or 5 places each time she came because it was so severe. And one day she walked in, she was completely normal. There was no anxiety, no depression, nothing. And then also she felt fine about her appearance. Everything was gone. It was just astonishing. And she stayed like that for a number of months, and the last I've heard, she's still doing well, but for complicated reasons, her family made her take less antidepressants, so she remained somewhat depressed, but all the other problems did not come back. The panic attacks, the pain, this body dysmorphic disorder, and so on. Now, the other lady was a woman that I've treated for 22 years, from the age of 20 to age of 42. And since a young age, she was chronically anxious, and from the time I met her, she had panic attacks, massive panic attacks, unless on medicine. She had generalized anxiety disorder, so she worried, and she worried in the evenings about what was going to happen the next day at work, although there wasn't a lot of stress at work. It was a routine job, but then she couldn't fall asleep without medicine because she'd be so anxious. And she had chronic depression, and she had OCD symptoms, and she had anorexia nervosa, eating disorder, where she would have to stay at 115 pounds, and had all sorts of rituals and OCD-like list of things that she could eat and not eat. And it was torture for her family to have her living with them. So they made her get a separate apartment. And she didn't socialize, and she was just caught up on these things all the time. And then when she was 42, she developed a really severe depression. She never had one before, but it was a really painful depression. She came in, we did the TMS, and she got normal in 30 treatments or something. And it was the first time in her life that she felt normal. In retrospect, she realized that she had been much more depressed than she thought. And then over the next 3 or 4 years, all of these other problems gradually went away. And I didn't see her very often, so I knew she was better. But then one day she came in, and I went down everything. You know, anxiety disorder, no. Panic attacks, no. Depression, no. Everything obsessive compulsive symptoms, no. And I said, well, what about the eating disorder? She said, well, I weigh 145 pounds. That's okay. And after years of being at 115, I hadn't noticed the difference because she's a little tallish, and 145 was fine. But everything is gone, and you could argue that maybe it gradually went away because since she was no longer depressed, she could fight these things. It's possible. But I've never seen that happen, that so many things would go away. And her parents were convinced it was the TMS because she'd keep improving in one thing, it'd get a lot better, and then she'd plateau for a while, and then other things would start to get better until everything, it's just like a miracle. And Downer has seen a couple of these. I saw him at a conference in February, and I asked him, and he hasn't published on this yet, but somebody should, maybe I will, that this occasionally happens. But both of these people had BDD, and they got better. Now, this BDD is related to OCD. OCD involves being preoccupied with details. There's OCD that has to do with concern about contamination and washing, so the person may have to wash for half an hour, or if they touch something, then they feel like they have to go wash, or they may worry that they had some contact with somebody of the opposite sex, and then they're worried they're going to give AIDS to their wife, although they didn't actually have full congress with this person. I had someone who was obsessed that he was going to give AIDS to his wife or somebody, but he thought he'd get it from a toilet seat, which he knew it was irrational, but he just had this dread. And then there are those with doubts about accidental harm, that they're worried they're going to make a mistake and somebody in the family is going to get harmed. I've had two people that one couldn't drive a car and the other one barely could, but when they drive down the street, they think, wait a minute, did I hit that person back there? And the one young lady had to turn around and go back to make sure she hadn't hurt them. And it was torture. It's torture for both of these people. And that's a form of OCD. Another one is having to have things symmetrical, everything just right, and arranging things, or maybe counting rituals that you have to count steps as you go up to them. And everything has to be precise. Now, I do that some when I'm writing, trying to perfect somebody's chart. I might spend an extra hour perfecting it. That's time I could use somewhere else. Or I'm writing up a summary of how to do things that I'm sending to other doctors or something. And I can spend an enormous amount of time trying to do that just right. And it doesn't interfere with my life that much, but that's a sub-threshold OCD symptom. And then a fourth type is somebody who has unacceptable taboo thoughts. For example, I had a patient who I first treated when he was a resident. When he was a resident physician, he had OCD, and he would spend too much time looking up in the PDR drug interactions. Now, if you use the same 3 drugs to treat cancer in all the patients that have cancer that are relatively healthy, then you don't need to reinvent the wheel and look up drug interactions between those 3. They've been used for years. And so then he would end up being up way late at night and not finish all his reports or his billing and get into trouble. Well, as the years went on, when he was in private practice, his OCD got worse. He didn't live near here, he lived somewhere else. And he began to have distressing images. When he would examine a woman, he would have images of her having bloody razor blades cut her, and that the blood would flow out. And he was a very non-aggressive, nice guy. So this was a really disturbing image. And it was so bad that after a while he just could not examine women. And he had to give up practice. I guess he went and worked for an insurance company or something. But that's an example of unacceptable taboo thoughts. Now, in the many studies now that show that TMS works well for OCD, and we've really had some great successes. And in fact, that second lady, the one that I treated from 20 to 42, she had relatively severe OCD symptoms, and not just the BDD symptoms, but other OCD symptoms. And they went completely away, and they're still in remission a few years later. Now, other things that are related are autism spectrum disorder, people who have mild autism, and they have, for example, preoccupation with certain interests, and so they'll get caught up in the details, and they often have routines and rituals they have to do, and they insist on sameness, and they're inflexible about a lot of things. And that's very similar to OCD. And there's also a few, they're mainly case reports of treating autism spectrum disorder, ASD, with TMS. Then there's hoarding, people that just can't throw things away. I'm a little like that, and so things just keep accumulating. And I have one patient, you can barely walk around in her house because it's just piled up with things. There's trichotillomania, people who pull in their hair or are constantly picking at their face. That's an OCD like disorder. And then there's another interesting disorder, obsessive compulsive personality disorder. And these people, they don't really have obsessive compulsive symptoms. They have a personality like this. And they're preoccupied with details, and they have to follow the rules. And I have one friend who works for the fire department, and whenever anything goes wrong in the fire department, he said, well, this is not according to the rules. And there's somebody in Shakespeare's Henry IV, Part 2, a fellow from Wales, I think, who was constantly talking about the rules of war. And he was right about these things, but he just drive people crazy. So they had such a hard time with him that they moved him to the fire department museum. So then he can talk all day to the people that come in, but the firemen don't have to listen to him. And then they're very perfectionistic, they're very devoted to work and productivity, and they're very overly conscientious, and they're inflexible about things. And they can't throw things out, and they want everything their way, and so it's hard for them to delegate tasks. And they're very miserly, and they're just rigid and inflexible. I had one fellow who he would be like this, and then his wife would be ready to divorce him, and the people at work hated him. And I think he was in a position of management, so he couldn't get fired as easily. And so finally he came to see me, and I put him on 80 milligrams of Prozac, and he just got likable and flexible and got along well at work. His wife liked him. But he never thought anything was wrong in the first place, so then he would stop the medicine and the whole thing would start again. but everything had to be his way. And then I had another patient who, very similar. He had one big problem that I can remember with his wife, is that when his wife and his daughter or daughters would cook a meal or cook, it wasn't right. The way they did it wasn't right. It should be done this way and that way. And he would just argue with them, but I'm right. The way I say is right. And there would be these fights about how. So finally, his wife divorced him. And so I say, well, how are they getting by? Cooking the food without you. And it's getting done somehow. They're eating and thriving. Well, it doesn't matter. He says they're not doing it the right way. He was just totally inflexible. And it's hard for these people to get treated because they generally don't admit they have a problem. I've seen a number of these people. It's egocentric to them. So it's hard to convince them to take a lot of serotonin medication. In any case, there's this connection with body dysmorphic disorder with OCD, and the body dysmorphic disorder, as I said, is greatly underappreciated. That I've missed it quite a few times by not asking about it. And it's probably important to start treating them young, to find out when they're a teenager, because it starts at 17, and we think it gets more malignant as people get older. So if you treated it at that age, the brain is more flexible, it's more plastic. If you put them on a serotonin medicine or get them CBT psychotherapy, it's going to improve them a lot. And then TMS works better at that age too. If you did everything, you'd have a good chance of giving them a shot at a normal life. And the TMS is underused in people with just mild to moderate disorders, whether it's depression or BDD. Only the really treatment-resistant people come to us, and we get 1/3 of them all the way normal in 30 treatments. And we get more of them if we can just go longer. But when you have somebody that's only had one depression or easily treated depression, then they respond even better. And I'm sure it's the same way with early BDD, that if you catch them early. Now, two other things I want to mention is if anybody's getting closer to 60, they should be on a very low dose of lithium. You can get lithium orotate on the internet, 5 milligrams or so per day, because very low doses of this prevent conversion to Alzheimer's, and there's a number of papers proving this. And the other thing is everybody needs vitamin D, which is a hormone that we make when we're in the sun, but we haven't been hunter-gatherers for 12,000 years now. But in the 50,000 years, like for people that are Europeans, for the 50,000 years before farming, they were hunter-gatherers, roaming from place to place every few months, and their only clothing choice was leather or weaving something. So in the summer, they probably didn't wear a lot. And then they make 10,000 units a day of vitamin D, and our levels would be 70 or 80. But everybody in this country has a level of below 30 practically. But it's a very important hormone that we make, and you have to take it, and it reduces your risk of infections in the winter and reduces the risk of breast cancer and colon cancer by 70%. Thank you very much.